it is forfeited forever, and it goes toward paying down the national debt. Now, I'm not going to sit here and tell you that if you took all of the salaries from all of the senators and all of the House of Representative members, that it's going to solve our debt crisis. It's not, because our debt crisis is too big. But I guarantee you this much: it will create a debt problem for the members of that chamber of Congress who do not do their job. The American people have a reasonable expectation that elected officials come to Washington to be the voice of the American people and to do the bidding of the American people. And that means doing their job. And if they're not going to do their job, they shouldn't get paid. So, to summarize, you've got a tremendous amount of uncertainty being introduced by the fact that the Senate will not take up and pass a budget. And we need Washington to learn to live within its means. And that's why we need a balanced budget amendment to the Constitution of the United States. I have supported that. And that's why we need the Pass a Budget Now Act to pass, because we should not be paying elected officials to come up here and just sit in a seat. They need to be doing the job that the people sent them here to do in the first place. So, Tammy, thank you for asking that question. I want to ask you the polling question again that I asked you a few minutes ago. Last week, I voted to ban gender-selective abortions. That is, prohibiting mothers from aborting babies based on the child's gender. Would you have voted to ban this practice too? Press 1 for yes, press 2 for no. I'd appreciate your feedback. If you would like to ask a question, press 0 on your keypad, and we'll get you into the question queue, and then we'll get you right back into the call. Let's go down to New Middletown and talk to Mike. Hi, Mike. How are you, buddy?
Just fine, sir. How's yourself?
I'm doing well. Thanks for calling in.
My question is, when you spoke to employers in your district,
right,
did they express any reservations about hiring because of the unknowns in the health care law and the unknown in the tax situation starting 1 January?
Yes, they did, Mike. I'm really glad that you asked that question. Absolutely, they did. Did you know that 40% of America's businesses, small businesses, are saying that the health care law is the main reason why they're not growing and expanding and hiring? I have talked to countless numbers. In fact, I can't think of an employer that I have talked to that's not one of the major reasons why they're not growing and expanding their businesses. Now, some of them want to, and as the Marcellus and the Utica Shale continues to advance, that they want to be able to, but they are very concerned about the rising cost of health care in their companies as a result of the president's health care law. You know, the president promised us that this was going to be a job creator. It hasn't created jobs. In fact, it's killing jobs because, like I said, 40% of America's small businesses are saying that's the reason they can't hire and expand their businesses. The president promised us that it was going to lower health care costs. We know now that that's not true either because the Congressional Budget Office has said that this is going to cost roughly $2 trillion more than the president originally told us that it was. And the president also told us that law was going to allow us to keep our own doctors. And now we know that that's not true either, because 1 in 3 healthcare providers are opting out of treating Medicare patients because Medicare was cut. $500 billion, $500 billion, came out of Medicare in order to pay for the president's health care law. That's what President Barack Obama and Nancy Pelosi and allies like Congressman Charlie Wilson voted for and placed into law. I can tell you that many employers are very concerned about what's going to happen when all aspects of the president's health care law is put into effect by 2014. That's why I support a total repeal and replace. Repeal the law, replace it with common sense, patient-centered solutions, solutions that keep medical decisions between patients and their doctors, solutions that ensure that we protect Medicare for current seniors, those 55 years of age and older, so that they receive no decrease in their Medicare coverage. They've invested in this program. They can't roll back the clock and put their money somewhere else. It is a responsibility of the federal government to honor that commitment. I want to see us allow Americans to invest in health savings accounts with pre-tax dollars so that they can provide some of their own routine health care at a much lower cost than buying a big, expensive health care policy. And they can even channel some of those dollars to buy a catastrophic policy at a low cost for things like cancer and heart attacks and the like. I want to see us increase competition by making health care portable from state to state and job to job. And I also want us to keep the doctors in the treatment rooms and the operating rooms rather than in the courtrooms by implementing tort reform to make it difficult for frivolous lawsuits to go forward. You know, anytime that you spend trillions of dollars on anything, you're going to get some good out of it. So there's a couple of things that I want to see that we keep, like pre-existing conditions. I think it's great that healthcare providers, health insurance companies cannot eliminate or deny coverage because of pre-existing conditions. Some people don't have a choice about those things. They don't have a say-so in what kind of health condition they have. Some people are born with health conditions. Others acquire them over time, but they ought to still be able to be insured. In addition, in this kind of economy where many young people are graduating from college with massive debt, first of all, to get through their schooling, and then they can't turn around and get a job, they need to be able to receive health care. And so I think it's a good thing that parents would be allowed, not mandated, not required, but allowed to keep their children on their health insurance policies until they're age 26. I think that's a good thing. So patient-centered solutions, protect health care, or protect Medicare for current seniors, protect it and strengthen it, preserve it for future generations, and then make sure that we keep health care decisions between patients and their doctors, not putting it in the hands of an unelected panel of bureaucrats in Washington, D.C. Hey, thanks for asking that question. It was a very important one. I'm going to ask you this polling question one more time, and I appreciate your feedback. Last week I voted to ban gender-selective abortions, which means prohibiting mothers from aborting babies based on the child's gender. I'd like to know if you would have supported that same practice to ban it as well. Press 1 on your keypad for yes, press 2 for no.